Hello everyone. In this video, we are going to talk about the vessels and the nerves of the pelvis. Let's start with the arterial supply. In the abdomen, the descending aorta bifurcates into the left and right common iliac arteries. The common iliac arteries bifurcates at the pelvic brim opposite the sacroiliac joint into the external iliac artery and internal iliac artery. The internal iliac artery divides into a short posterior division and a long anterior division. The posterior division has three branches, which supplies the parietal regions. The anterior division has 9 branches. Let us now see what these branches are. First, let's look at the branches of the posterior division. First, we have the iliolumbar artery. It runs in front of the lumbosacral trunk, behind the obturator nerve, and laterally deep to the psoas muscle. It has 2 branches, as the lumbar branch and the iliac branch. The lumbar branch is considered as the 5th lumbar segment and supplies the psoas, quadratus lumborum, and erector spinae. The iliac branch supplies the iliacus muscle and iliac bone. It also forms an anastomosis around the anterior superior iliac spine. This is an important point to remember. It forms the anastomosis with the deep and superficial circumflex iliac arteries, the ascending branch of the lateral circumflex femoral artery, and the superior gluteal artery. Next is the lateral sacral artery. It runs lateral to the anterior sacral foramina in front of sacral plexus. It supplies the piriformis and the muscles of the back of sacrum. It supplies spinal meninges and roots of spinal nerves by entering through the anterior sacral foramina. It also supplies the sacral segments. The superior gluteal artery is the largest of the internal iliac artery branches. It passes backwards between the lumbosacral trunk and S1 nerve while piercing the pelvic fascia. It then leaves the pelvis through the greater sciatic foramen above piriformis to supply the gluteal region. Now let's see the branches of the anterior division. First is the superior vesical artery. The distal part of it becomes the medial umbilical ligament. The ligament is a direct continuation of the superior vesical artery. It runs along the walls of pelvis to supply the upper bladder, ureter, and vas deferens. The inferior vesical artery emerges lower and runs medially to supply the lower bladder, trigone, ureter, vas deferens, seminal vesicles, and prostate. In females, it corresponds to the vaginal artery which supplies the upper vagina. The middle rectal artery supplies rectal muscles and is either small or absent. The uterine artery crosses the pelvis under the broad ligament and above the ureter. The uterine artery runs along the sides of uterus and runs laterally along the uterine tubes. It anastomoses with the ovarian artery, which is also known as the gonadal artery, that corresponds to the testicular artery in males. Then there is the obturator artery. It passes along the side walls of pelvis and enters the obturator foramen with its vein and nerve to pass into the thigh. It then divides into an anterior and posterior branch, which supplies the medial thigh muscles, head of femur, and knee capsule. Then we have the inferior gluteal artery. It runs backwards, passes below the S1 nerve root, and leaves the pelvis through the greater sciatic foramen below piriformis to supply the buttock. The internal pudendal artery lies in front of the inferior gluteal artery. It passes through the greater sciatic foramen below piriformis and enters the pelvis again through the lesser sciatic foramen to supply the perineum, anal region, and external genitalia. Out of these, the internal pudendal and inferior gluteal vessels are considered as the terminal branches of the anterior division. Now, let's talk about the venous supply. The internal iliac vein is formed by receiving tributaries above the greater sciatic notch and passes upwards posteriorly and medially to the internal iliac artery. It's joined by veins corresponding to the arteries of the pelvic region, such as the gluteal veins. It also receives tributaries from the rectal, vesical, uterine, prostatic, and vaginal venous plexuses. Because of these venous plexuses and large veins, there may be severe retroperitoneal hemorrhage resulted from pelvic bone fractures. This is an important point you must remember. Also remember that lateral sacral veins communicates with the vertebral venous plexus. Thus, pelvic carcinomas may spread to vertebral regions. Most importantly, remember that the pelvic veins have no valves. Now let's talk about the sacral plexus. The sacral plexus is formed by the nerve roots L4, L5, S1, S2, S3 and S4. Part of L4 and the anterior ramus of L5 combine to form the lumbosacral trunk. The lumbosacral trunk joins the upper four sacral nerves to form the sacral plexus. It's also important to remember that the posterior divisions of nerve roots supply extensor muscles and that anterior divisions supply flexor muscles. The sacral plexus lies lateral to the anterior sacral foramina, in front of piriformis and behind the parietal pelvic fascia. Here, I will show you an easier method to remember the nerve roots of each nerve formed by the sacral plexus. First, write the numbers of the nerve root segments from L4 to S3 and a diagonal line as shown. Then, write two numbers which goes next below each number, forming a column with three sets of numbers in each. If you write 5 somewhere in the middle of a column, the next number should be 1. Now that you have 5 columns, separate the numbers as shown. The first column, which corresponds to nerve roots L4, L5 and S1, provides nerves to the superior gluteal nerve and to the nerve to the quadratus femoris and inferior gemellus. L5, S1 and S2 provides to the inferior gluteal nerve and to the nerve to obturator internus and superior gemellus. S1, S2 and S3 provides posterior cutaneous nerve of thigh. S2, S3 and S4 provides to the pudendal nerve. Finally, the first diagonal row L4, L5, S1, S2 and S3 makes up the sciatic nerve. You can remember the order through a simple mnemonic known as SIPS. SIPPS. Let's talk about each nerve briefly. First, it is superior gluteal nerve. It passes out of the pelvis above the piriformis muscle to supply the gluteus medius, gluteus minimus, and tensor fascial artery. The nerve to quadratus femoris supply quadratus femoris, inferior gemellus, and the hip joint. Inferior gluteal nerve passes out of the pelvis below the piriformis muscle. It supplies the gluteus maximus. The nerve to obturator internus appears below piriformis to supply the obturator internus and superior gemellus. The posterior cutaneous nerve of thigh passes backwards below the piriformis, behind the sciatic nerve and enters the gluteal region. It passes in the midline of thigh and leg and supplies fascia and overlying skin. It also supplies some skin over the buttock and posterior part of scrotum and labium majus. The pudendal nerve passes back between piriformis and coccygeus, medial to pudendal vessels. It appears between piriformis and sacrospinous ligament to supply the perineum. A sciatic nerve appears below piriformis and divides into tibial and common peroneal branches to supply the lower limb. There are also a few more minor branches in the sacral plexus as well. The piriformis is supplied by a separate branch from S1 and S2. The coccygeal plexus consists of branches of S4 and S5 and coccygeal nerve. It supplies postanal skin over coccyx. Muscular branches of S3, S4 supply pubococcygeus and iliococcygeus. A perennial branch of S4 supply puborectalis, pubourethralis, pubovaginalis, and perineal skin. Now let's talk about an important nerve plexus of the pelvic region known as the inferior hypogastric plexus. It is an autonomic plexus on either side of pelvis, which lies lateral to rectum. Its sympathetic components are derived from the superior hypogastric plexus via hypogastric nerve and from sacral sympathetic ganglia. Please note that there are 4 sacral sympathetic ganglia in the sacral sympathetic trunk. Preganglionic parasympathetic fibers join the inferior hypogastric plexus from S2, S3 and S4 nerves. This is also known as the pelvic splanchnic nerves. This image shows both the superior and inferior hypogastric plexuses. In addition to all above, there is one more important nerve of the pelvic region, even though it is formed by the lumbar plexus. This is the obturator nerve. It is formed within the psoas major from the anterior divisions of 2nd, 3rd and 4th lumbar nerves. It supplies the adductor compartment of thigh by piercing the medial border of psoas and passing along the side walls of pelvis to the obturator foramen. As it lies in close proximity to the ovary, being separated only by the parietal peritoneal lining, pain from the ovary may be referred to the skin on the medial side of thigh. An accessory obturator nerve may also be present. Thank you for watching. If you like our content, please subscribe to Med Diaries.